When the virus began to spread in Pennsylvania, public health officials turned to testing to help track it and administer care to those in greatest need. St. Luke's University Health Network went into action, providing mobile testing sites where someone with symptoms could get a test. Dr. Jeffrey Jerry is an infectious disease specialist treating COVID-19.
And what one does then is to get a specimen that is either done with a swab through the nose or through the back of the throat. And that test now can be run both in-house at St. Luke's, and we also have arrangements to run it with many commercial laboratories like LabCorp.
Dr. Jerry explains this type of test can get accurate results back within 24 hours, helping doctors begin to isolate others who could have been infected.
Those tests that we do right now for active disease, an individual can get that by going through any St. Luke's urgent care or any St. Luke's practitioner's office, and that test will be processed.
For some time, a shortage of testing material set limitations on the amount of testing that could be done.
There you go, perfect.
Now, Dr. Jerry says there's a new test approved that is a lot like a rapid strep test, which will go a long way to help with mass testing.
So we do advise, if you're going to be going to a physician's office or to an urgent care, that you do call ahead. Currently, the advice is to try and limit the testing to people who have symptoms or who have some other reasons, such as very close contact with an active case.
Now that the surge of cases has subsided, Dr. Jerry believes contact tracing can be an effective way to start limiting the spread of the virus.
Contact tracing relies on the ability to not only identify a positive case, but then to take a look at individuals who've had close contact with that positive case and see if they're positive.
That's because about 1/3 of people who have COVID-19 will have little to no symptoms, meaning even if you feel relatively fine, you could still spread the virus. If doctors and nurses at St. Luke's can identify someone with the virus through testing, the patient can quarantine for little more than a week, and that's a big way to help prevent it from spreading. One more kind of test is available, an antibody test, which determines if you had COVID-19 already by testing for the antibodies that fight the infection. If you are in need of a test, call ahead to 1-866-ST. Luke's. Jim Hamill for the Pocono Television Network.